Do you support Obamacare or the Affordable Care Act?
Affordable Care Act.
I don't have that stupid Obamacare. I'm covered by the Affordable Care Act.
The Affordable Care Act is Obamacare, genius.
Why is that?
Well, I mean, I'm not the biggest fan of Obama, so I don't support him in the Obama things that he's got going on. I'm actually really excited for President-elect Donald Trump. So.
Right. So you don't like anything Obama does, and you prefer the Affordable Care Act?
Absolutely.
Do you support Obamacare or the Affordable Care Act?
I support Obamacare.
So if you were a senator and you could vote today, you would vote to keep Obamacare instead of the Affordable Care Act?
Yes.
Do you support Obamacare or the Affordable Care Act?
I guess the Affordable Care Act?
I don't have that stupid Obamacare. I'm covered by the Affordable Care Act.
The Affordable Care Act is Obamacare, genius.
And why do you prefer the Affordable Care Act over Obamacare?
I'm not really sure. My girlfriend supports Trump, so I go with whatever she says.
What is the main difference between Obamacare and the Affordable Care Act?
One is you pay, and then the other one is Obama pays for you.
Right, Obama pays, pretty big difference.
Pretty big difference.
I believe that Obamacare, the premiums are too high, so people end up paying more. So I believe in the Affordable Care Act.
And so the Affordable Care Act is more affordable than Obamacare?
Right, correct.
Right.
Which is obvious based on the name.
It's in the name, right.
Right.
Why do you like the Affordable Care Act more than Obamacare?
Because I don't like Obama.
But you like the Affordable Care Act?
Yeah.
What if I told you Obamacare and the Affordable Care Act are the same thing?
Hello guys, welcome back. You ever noticed how some MAGA supporters yelled, "Keep your ACA but get rid of the Obamacare"? Well, jokes on them. It's the same thing. Now that funding cuts are rolling out, they are now realizing they have been cheering against their own health care. But the truth is, Black Americans warned them. They just didn't want to listen because they thought Obamacare was only meant for the black people, the black Americans. Good people, let's watch some clips here, then come back and have a talk as far as this topic is concerned. And of course, if you love our areas of discussion, please subscribe and leave us a comment in the comment section. Let's dive, guys.
So MAGA, you're upset now because now you're finding out that Obamacare and the Affordable Care Act are the same thing. You voted to get rid of Obamacare. I guess because you thought Obamacare was only for you know who. Not knowing that the Obamacare and the Affordable Care Act are one and the same. It was the Republicans who told you and gave the Affordable Care Act the nickname Obamacare. They did it to scare you, and you fell for it. So you voted out of hate to try to get rid of something out of hate. But now you're not going to have health insurance because he has been trying to get rid of the Affordable Care Act since his first time in office. And now that he has no guardrails, it's gone. He's going to try everything in his power to get rid of the Affordable Care Act. So all of you who voted to get rid of Obamacare, you just lost your damn insurance. Oh well, I guess you live and you learn.
I don't have that stupid Obamacare. I'm covered by the Affordable Care Act.
The Affordable Care Act is Obamacare, genius.
Obamacare was not a disaster, and I really wish y'all would stop spreading that lie. And it's got to be because either A, you're too young to remember what the financial market and environment looked like back in like 2006, 2008, or you got a very short memory. I entered the workforce back in 2006, the same year I entered college, and the minimum wage was $5.15 an hour. Maybe 1 or 2 years after that, it was $6.55 an hour. At $5.15 an hour, $6.55 an hour, you were not getting insurance through the company. I remember that vividly. That premium was going to at least eat up 1 week of your check, and you only making $200 a week anyway. And you for damn sure wasn't going to get it privately because the premiums are even higher. This is why people back in the day told y'all, get a job with the post office, get a job with the city, get a job with the state, work for the government. Why? Because you may not get rich working for the government, but them benefits are going to make sure you're taken care of. But if you want to know the value of the ACA, you can just look at the benefits they celebrate. Do you know how many people were denied coverage due to pre-existing conditions? Do you understand how many people had the prices of their insurance jacked up just because they got sick? Y'all are harder on this legislation than y'all are on the companies that cause need for legislation. High premiums existed long before the Affordable Care Act. High deductibles existed long before the Affordable Care Act. Medical debt definitely existed long before the Affordable Care Act. In fact, medical debt has always been one of the leading causes of bankruptcy in the United States. The Affordable Care Act was originally meant to be a step toward universal health care. The problem is nobody else has taken another step to actually accomplish the goal of universal health care for citizens of the United States. Y'all got to start doing some research on your own instead of regurgitating these talking points that are completely unfounded.
Norway, United Kingdom, Brazil, they all have free health care for their citizens. Countries like Australia and France have free health care for their citizens, but they may have copays in certain situations. But copays. Why do we not have free health care in our country? Oh, fearless leader, I shouldn't say that. Donald Trump has been saying for 10 years, I'm working on it. We'll have it planned out in 2 weeks. We'll have it planned out in 2 weeks. He said that his whole 4 years, his first term. Who's saying it now? MAGA Mike Johnson saying, well, we got to get rid of Obamacare. We got to get rid of Obamacare. Yet he doesn't come up with a game plan for replacing Obamacare. Obamacare was a starting point. Then you build from Obamacare. You build onto that. You make it work. And it's been working for millions of Americans across the country. Now you're going to rip it away just to give millionaires and billionaires the tax breaks that you promised? Think about this. The man stands up in front and rips on John McCain. He's standing in front of the press ripping on John McCain for giving the famous thumbs down. Oh, still giving me PTSD. You think you've got PTSD? Your health care doesn't cost you shit. And all you have to do is sit there and just allow healthcare to go, these subsidies to continue. That's all we're asking for. No one's asking for free healthcare at this point. The Obamacare still isn't cheap. It was a starting point, and you're calling it a failure. If that's the case, then why are 18 million Americans scared to death that they're going to lose their healthcare? You don't even have a clue what's going on in this country, let alone the goddamn Congress.
I never thought I would see the day when I agreed with Marjorie Taylor Greene. What the hell is happening? Marjorie Taylor Greene has just come out and said she's blaming Speaker Johnson. She's blaming the House. She's blaming soon the majority rep because her constituents are calling her and saying that if they take away the ACA credits, the cost of their health insurance is going to rise significantly and they will not be able to afford health care. Marjorie Taylor Greene. Let that sink in.
Overnight, Democrats got a new unexpected ally on the issue of extending the expiring Affordable Care Act subsidies at the very heart of this shutdown debate. It's Republican Congresswoman Marjorie Taylor Greene of Georgia who broke with her own party yesterday, writing a lengthy post on social media calling for action to extend Obamacare subsidies and prevent insurance premium hikes. Greene wrote in part that her adult children who are covered by the ACA have health insurance premiums that will double next year if Congress allows the tax credits to expire. Yeah, them and millions of other Americans. And slammed Republican leaders for failing to address the subsidies issue.
I am shaken that she has even gone there because this is the first time that this woman has said anything that has made sense to me, at least.
So yesterday I posted a video talking about how we need to end the division because that is exactly what this administration thrives on. They are single-handedly creating the division that exists in today's country. I talked about how we're stronger together, how they want to take this two-party system and turn it into a one-party system, and that if you're actually a patriot, you care about the Constitution, you care about being an American and for other Americans, that we should put our differences aside. And this is the response I got. You're paying pennies on the dollar for people to be able to feed their children, to be able to feed the elderly, the disabled, veterans, foster children. These are the people that are taking advantage of these social support systems because they paid into it at one point in their life. Something that people forget about is that you are paying into it always as a working class American, as I continue to do so since the first time I got a job when I was 15 years old. Got a job. I've been paying into this my entire life. Have I ever had to use it? No, but I did have to use unemployment going into 2020 and going into COVID. It was amazing because I was able to keep up with paying my rent, paying my bills because of this support system. I was able to get off of it and go back to my career. In 2021, I was making $80,000 a year. In 2022, I was making $100,000 a year. In 2023, I was was making $150,000 a year as a full-time employee, not even including my side six-figure business. And to this day, I do not believe that I would be where I am today if I did not have the support from unemployment. Talked about how SNAP benefits are going to expire on November 1st. And there are people out there that are making fun of, laughing about people that are going to be starving. These same people that say that they reflect Christian values. Well, I hate to break it to you, but if Jesus were alive today, you'd call him woke. Now let's talk about this health insurance thing that we should blame Obama for. Obamacare. Funny enough, Obamacare actually came from critics. So they were calling it Obamacare as a diss when it was really the ACA, the Affordable Care Act. But later on, the Obama administration, they embraced it. Obamacare, it's amazing. This person has access to the same factually cited information as I do, but clearly they do not reference it because they choose to remain ignorant. However, I have pulled up cited information, which I know this party also refuses to accept as factual information, even though it is cited and unbiased. So why was Obamacare, aka the ACA, the Affordable Care Act, the most affordable option in modern America? Before the ACA, millions of Americans either couldn't afford or qualify for health insurance. Here's why the ACA was such a major shift for Americans. Obamacare made health insurance more accessible for all Americans, for working class Americans. I make $150 an hour. I don't know how much you make. We're still working class Americans. I see someone on SNAP benefits as my equal because we're in the same class. Something that was literally life-changing for people was that pre-existing condition bans were eliminated. So before the ACA, insurers could deny you coverage or charge more if you had conditions like asthma, diabetes, or a pregnancy history. Which that's not fair. Why should you have to pay more for the same exact service that you would be getting just because you have diabetes or you have a severe allergy or whatever it might be? Children could stay on their parents' plan until age 26. This expanded coverage to millions of young adults. This single-handedly kept me from going into bankruptcy when I was in my mid-20s. I was suffering from severe pain from my menstrual cycle. I have endometriosis. I did not know it at the time. I would have such bad pain the first few days of my period that I would literally black out from that pain. I would vomit from it, and I would literally get to the point where I would have to be brought to the hospital because there was nothing else to do, and they would literally just give me morphine. I had made at least a dozen trips to the emergency room because of this unbearable pain. That was covered by my insurance that I had until 26. It created the health insurance market. This did not exist before, and it's incredible because the ACA launched what was the healthcare.gov and state exchanges where individuals could compare plans similar to shopping for flights or hotels instead of relying on employer coverage. That's amazing. Why would you not want access to that? Why wouldn't you want to compare plans? Seriously. And they also introduced what was income-based subsidies. So the government began offering premium tax credits and subsidies to lower monthly insurance costs for people earning roughly 100 to 400% of the federal poverty level. This made private health insurance affordable for middle and lower income Americans for the first time in modern history. Why is it that in America we're even still paying 3 times more than any other person in the world for the same healthcare? And when I say same healthcare, we're not taking into account the fact that our healthcare system is extremely broken. Nurses and doctors are spread completely thin. Overall quality is so dismal compared to other nations. It also expanded Medicaid. So the ACA allowed its states to expand Medicaid to lower income adults. Why would we not want someone to be able to get affordable healthcare? Also, when we're thinking about this and like where our tax dollars go, I will never stop talking about 2 things. Most recently, wasting $300 million, which is probably going to end up being double the cost for this ballroom where there should be no dancing. That is not why these people are in these positions. And the fact that Trump sent $40 billion to Argentina for their government. Imagine what that $40 billion could have done for Americans. But we're not going to talk about that. We're going to talk about the $30, $36 a year that you're paying so that every single American can be fed, because it's a basic human right. Also focused on preventative care. Preventative services like vaccines, screenings, birth control, and checkups, they became free with most insurance plans, helping catch diseases earlier and reducing long-term healthcare costs. That's amazing. Why would you not want preventative care? Why would you not want that accessible to all? Because in the end, if preventative care is available to all of a sudden, a lot of the more extreme cases down the line are no longer even a problem because of that. The impact, the uninsured rate in the US dropped from about 16% in 2010 to under 9% by 2016, the largest increase in health coverage in US history. While premiums still rose over time, mainly due to healthcare inflation and insurer costs, which has nothing to do with Obama, for many Americans, ACA subsidies made coverage far more affordable than what was previously available on the individual market. So yeah, the ACA, it fixed accessibility, but not affordability at the root. And that is a whole nother slew of problems and things that we need to figure out, but it had nothing to do with Obama. And guess what? Drug costs are only going to go higher because of Trump's fucking tariffs. Yeah, the ACA, Obamacare, it made healthcare coverage more accessible and equitable, but it did not dismantle the for-profit driven fragmented structure that makes American healthcare the most expensive in the world. Until the US addresses price regulation for hospital and drugs, which Trump is doing the exact opposite, administrative waste, and the fee for service incentive model, health insurance will continue to be and feel unaffordable, even when more Americans have it today, which they're going to likely lose by the end of 2025. Which the reason why we're in this predicament to begin with is because the government shutdown. It has nothing to do with Democrats. We don't own the House, we don't own the Senate, and we are not obviously in the presidential seat. So if negotiations stall and the funding impasse continues, here are some likely impacts on healthcare costs and coverage based on current reporting and policy analysis. Now, these are not guaranteed outcomes, but they are plausible given the dynamics at play. Key risks and cost drivers. Health insurance premiums could spike. One major issue, the ACA premium tax credits and subsidies are set to expire at the end of 2025 unless renewed. That's what the Democrats want, because if those subsidies vanish, analysts are estimating that the marketplace enrollees could see average premiums jump by over 100%, roughly 114. So say, for example, you're paying $888 annually, that could jump to $1,904 annually. Result, coverage becomes much less affordable for millions of Americans who rely on these subsidies to keep premiums manageable. So you wonder why people are on SNAP benefits and you're pissed about it? More people are going to be on SNAP benefits, because if you have to choose between a life-saving procedure and almost going bankrupt over it, or going bankrupt over it, or groceries, you can't eat when you're dead. So they're going to opt for the life-saving treatment, which I would assume the pro-life party is all about, right? And then they're going to be reliant on these benefits that they've been paying into their entire lives that they have not needed to use until filing bankruptcy because of how expensive everything is. Pragmatic disruptions and cost shifting. I know those are some big words, stick with me. Core programs like Medicaid and Medicare are classified as mandatory spending, so benefits don't immediately stop during a shutdown. But certain administration functions like provider payments, telehealth waivers, and support services may be delayed or modified, which could increase indirect costs for hospitals, providers, and patients early on. Some states may have to absorb temporary costs or reduce support programs, potentially shifting expenses onto patients and state budgets. Coverage loss and higher out-of-pocket burden. So if these subsidies, if they expire and coverage becomes unaffordable, more people could drop out of the marketplace and either go uninsured or move to higher cost plans if they have the privilege of being able to even pay for it in the first place. This can raise costs for the system as uncompensated care increases. We're all paying to play, but if we don't have everyone paying to play, guess who's footing the bill? Not the 1%. Hospitals serving low-income populations may face higher uncompensated care burdens, which often gets passed on to insured patients via higher premiums or service costs. Again, who's footing the bill? Working class Americans. State and provider risk. States that rely more heavily on federal transfers could face larger budget shortfalls if cuts or delays occur, leading them to reduce provider payments or eligibility, which again can raise costs for insured populations. We are footing the bill. I don't know how many times I have to say this. The ACA is a good thing. You're going to be paying more for yourself and into the entire program because of this bullshit. Providers, especially in rural or underserved areas, may lose certain support funds like disproportionate share hospital payments, which can lead to higher fees and cost shifting. So what does this mean for you? Because I know that a certain party only thinks for themselves, only cares if they are personally impacted. What does this mean for you in the broader system? If you're on an ACA marketplace plan and the subsidies aren't renewed, which is the Democrats are trying to get them renewed, the government shutdown is because Republicans own the House, the Senate, and Trump is in office. Are you staying with me? So if these subsidies are not renewed, expect your monthly premium or deductible out-of-pocket cost to go up significantly. For example, I'm a single woman. I don't have children. I have no pre-existing any health issues. I am a healthy girl. I got my blood work done. My PCP was like, you have the body of an athlete. Thank you. Guess how much I'm paying a month for my private health insurance? Almost $700 a month. So I'm going to be paying probably over $1,000 a month for health insurance, which is definitely more than 3 times of what we're already paying compared to everyone else in the world for bullshit compared to other healthcare systems and just like the quality of healthcare around the world. So even if you're covered through employer insurance, system-wide cost pressures, higher premiums, more uncompensated care eventually hit everyone, often via rising premiums or higher healthcare inflation. That's why it's so important to give a damn about other people. Even like this aside, but guess what? When things like SNAP benefits go away, it eventually impacts you because that impacts your local economy and that becomes an issue. Talk about like trickle down economics. Yeah, that's what's happening right now. Safety net programs remain, but the margin of safety shrinks if administration delays or funding costs reduce the effectiveness of enrollment, oversight, and provider support. So something to also keep in mind is that ever since the BBB passed, the big bullshit bill, there are hospitals that are already closing down. So there's only one there's technically 2 in Central Oregon. There's one in Bend and there's one in Madras. I have a friend in healthcare and she was telling me about how that hospital is literally talking about closing, which means there's only going to be one hospital, I believe, in Central Oregon that is going to be serving the greater population of this state. And the only other one, to my knowledge, is over the pass in Portland, which is like a death sentence going over that pass in the winter. People die. It's dangerous. It's not worth risking your life over to go over to that hospital. So we are literally walking distance from our hospital. But guess who else is going to be going to this hospital? Everyone else in Central Oregon, which means nurses, doctors, all their staff already spread thin are going to be spread even thinner. And like, we just had a nurse strike because they're not being compensated fairly. If there's another strike, like, we are literally fucked. And that goes into another thing that I wanted to bring up, which is if this happens, if worst case scenario takes place, the pro-life party, guess what blood is going to be on their hands? There is an estimated at minimum 50,000 Americans who are going to die annually from preventative illness because they did not have access to these life-saving procedures, all because there was no longer ACA subsidies that were able to let them get a hold of accessible and equitable healthcare services. What is still protected for now, fingers crossed, Medicaid and Medicare benefits for existing enrollees, they're not going to vanish overnight because they are mandatory spending programs, but that is subject to change because no matter how protected it is, it doesn't mean it's fully insulated from ripple effects like administration slowdowns, provider strain, etc. I spent way too much time on this video and I don't even think I'm going to change anyone's mind. It's fairly cathartic for me, but it is absolutely fucking ridiculous that we're here at this point in time and that I have to educate my fellow working class Americans on the fact as to why every American deserves to be fed. Every American deserves to be able to take a trip to the clinic, to the hospital, to the emergency room, if they need to do so. I don't know what Kool-Aid you guys have been drinking, but every other country in the world, they have access to all of this for free. And it's actually more affordable there because it's not for profit. The US already spends enough to fund universal coverage. It just does so inefficiently through insurance billing and profit-driven private insurances.
MAGA Congresswoman Marjorie Taylor Greene says Democrats are right about demanding subsidies for the ACA, the Affordable Care Act, Obamacare be extended. Let me show you her clip.
And to allow Democrats to have some sort of moral high ground on this issue because they're the only ones talking about it, I think is a major failure from the Republican Party. And I'm not going to stand there and just keep talking the talking points when my own adult children can hardly afford health insurance premiums, when everyone in my district, it's the #1 issue that I hear about day in and day out, not just people on the ACA, but people that have private insurance as well. And I think it's something that we have to talk about.
Now, what she's talking about, one of the Democrats' demands for giving their votes to reopen the government is that the Obamacare subsidies be extended. The subsidies are running out, at least a portion of them, by the end of the year. Some people's premiums will double. You know, my premiums are already $1,500 a month. I mean, it's very expensive. They could double for some people. And what she's saying is her own children's premiums are going to double, her own child. And that's what won her over. Now, a couple things here. One, she's admitting the Democrats are telling the truth about Obamacare being a problem as far as the subsidies. Two, she's admitting the Democrats are telling the truth that they're actually fighting for regular Americans. They're not fighting to get illegals funding. That's what the Republicans keep saying. She admitted it. What they're fighting for is helping real Americans. Final point here. The data shows that the majority of the folks helped under Obamacare with these subsidies are Republicans in Republican states and Republican districts. That's why she's freaking out. This is not good for the Republicans, for the shutdown. It's great for Democrats. We're finally seeing a crack in the wall, which is great.
There's an unemployed Trump voter who said they voted for Trump because he promised to kill Obamacare, but says he hopes Trump keeps his hands off the Affordable Care Act, which he relies upon. Obamacare is the Affordable Care Act. Here's what this guy wrote online. He wrote the following, quote, I just voted for him because he's going to kill Obamacare. I am unemployed and Obamacare effing sucks. I'd rather just have the ACA, the Affordable Care Act, by itself instead of this communism shit. And then someone responded to him by saying, Obamacare is the ACA. It is literally keeping you alive. You voted to take away your health care. And then the original poster wrote back, quote, why the F do people have two different names for it? Obama equals bad and affordable equals good. I effing hate Democrats. Well, if you remember, it was the Republicans who branded it as Obamacare originally to try to scare people like you. Maybe your hate should be directed at those trying to take away your health care and not the people who are trying to actually save your life. How about that?
We've got big news on the Obamacare funding front. Marjorie Taylor Greene, who is a huge MAGA member of Congress, Republican from the House, Trump's biggest defender, has caved and said we need to fund the Obamacare, the ACA, the Affordable Care Act subsidies, and fund them now. This is what Democrats have been demanding. This is why the government was shut down, because Republicans wouldn't fund it, among other reasons. And for her to admit it, she said, my kids' premiums are going to double if we don't fix this. And I don't like Obamacare, she said, but I don't want the premiums to double. That's ridiculous. She's admitting what Democrats are saying is true. The premiums will double unless the Republicans fix this. She's also admitting that Democrats are, this whole shutdown, this whole issue of what Democrats are asking for is to fix the subsidies. It's not to help illegals. It's to help people like Marjorie Taylor Greene's kids. She's admitting it. This is a big deal, guys. She's a wacko. This is the one who claimed that Jews had space lasers in space that were starting forest fires. She's crazy. For her...
Y'all, I'm having some major anxiety about these changes to the Affordable Health Care Act, Obamacare, that are coming down the pike. I don't know if you've gotten the notices in the mail, but, you know, a lot of the subsidies are gone. People are seeing hikes 3, 4, 5, 6 times as much as they were paying. I'm a full-time musician in Nashville, Tennessee. One of the only ways that makes it possible to live a life and run a business in the arts is by having affordable health care. If my premiums are all of a sudden astronomically higher, how does this work? You will have so many creative people, small business owners, just give up their dreams, give up the passion to innovate, to do the creative work that makes America great. I hope the Democrats can figure this shit out, because the Republicans, they could care fucking less.
Now guys, welcome back. MAGA supporters spent years attacking Obamacare without knowing it was just another name for the Affordable Care Act, the ACA. They were literally getting health coverage from the same law they wanted destroyed. Some even bragged about being on ACA while demanding that Obamacare be repealed. It was never about the program. It was about the name attached to the care, the Obamacare. The Obama was the biggest problem, not the care itself. Meanwhile, conservative voters believe that Obamacare was designed only to help the black Americans and immigrants. They saw it as a handout for immigrants, not realizing that it was built to help the working class families across the races. The MAGA media fed that narrative to the people, turning basic healthcare into a racial issue, a racial thing. And when Trump promised to end the Obamacare, they thought he was taking something away from the black people. And the black Americans said it loud and clear that you are voting to take away your own benefits. They warned that removing Obamacare would hurt everyone, not black people, but everyone, especially the poor white rural communities who depended largely on the Obamacare. But MAGA voters were so focused on undoing anything that was attached or tied to Obama that they didn't even see the trap. And right now, they are facing the rising premiums, cancelled coverage, and no safety nets. And the irony is, the very law that they wanted it gone was the one keeping them alive. Trump promised to replace Obamacare with something better than Obamacare. But years later, that something better never came. The cuts, the deregulations, and rollbacks hit the MAGA counties the hardest. Those small towns, farmers, and the working class families. While they were cheering for Obamacare to die, they never realized they were the next victims. Black Americans never celebrated because they were frustrated. They knew how these policies like the ACA saved lives regardless of the color. But when hate guides your politics, you end up hating yourself. Now, the same voters who say that get rid of the Obamacare laws are begging for the ACA to stay. Same law, same benefits, but different names until it's gone. Now, MAGA supporters are very angry, realizing that Obamacare and ACA were never two different things. And the people they mocked supporting it, the black Americans, were right all along. This isn't about race anymore this time. It's about the truth. Because at the end of the day, healthcare doesn't care who you voted for or who you are. But the policies do. So guys, what do you think about this video in the comment section? If you love this video, if you love our conversation, please subscribe and leave us a comment in the comment section, guys. And guys, may God bless you. This is your guy, Fred from the motherland.